Hi, everybody. Thank you so much for joining us today. My name is Kim Homer Vagadori, and I'm with the California Youth Advocacy Network. We are very excited this afternoon to be sharing with you our findings from our 2022 reports on smoke and tobacco-free college and university policies here in California. I have 1 o'clock and we actually have quite a lot of content to get through, so we're gonna just jump right in. Throughout this webinar, we do have it set up as a webinar setting, and so I believe everybody is muted, but we would love for you to ask any questions or share any thoughts along the way. If you have anything, just go ahead and utilize the chat box or questions and answers. Before we get started, I did want to take a second to recognize Crandallyn Goodman and Jocelyn Rodriguez from our team here at CYN. Crandallyn is one of our college program coordinators and works directly with our COF student partners, but also if you have gotten any resources and support when it comes to Grain Market Smokeout or Earth Day or just overall student engagement, Crandallyn is really the brains and energy behind all of that. So we're really excited to have Crandallyn on the team, and I'm grateful for her support of this report. And also Jocelyn Rodriguez, who is our program assistant and works across all of our different programs. And also Jocelyn was instrumental in the reports this year. If you have followed our reports in the past, you would know that we have done comprehensive analysis of our public institutions, and this year we're excited to release a report on private institutions, which is no easy feat to collect all of those policies, to organize them, and to do an analysis. And Crandallyn and Jocelyn did those together and have spent weeks collecting information, and Jocelyn has been on the phone calling campuses to get this information. So I just want to recognize them both and thank them for all of the time and energy and effort that went into our findings in our reports for this year. So I'm gonna just go ahead and jump right into the content. And again, thank you all for just listening in to our findings. We just released the reports 30 minutes ago, so you should have received them all via email. If you are not on our listserv, or if you are like me and our listserv messages go into your spam folder after many attempts to not have that happen, you can also find the reports on either our cyanonline.org site or our college website. And all of that information is also at the end of this webinar. So just to dive in and get started, if we have not had the opportunity to work with you yet, our organization, the California Youth Advocacy Network, is a statewide agency. We have funding through the California Tobacco Control Program. We also have some funds through the Orange County Department of Education to support K-12 schools. But our work that's funded through the Tobacco Control Program is really to support youth and young adult engagement in the effort to end the burden of commercial tobacco in California. And our college project specifically does that by really working individually with campuses to support them in their advocacy efforts to make their school smoke and tobacco free. If you are from a campus that is already smoke and tobacco free, then you may have already been working with us on implementation and compliance and tobacco treatment and education, and the work just never seems to stop even after the policy is adopted. And our goal with all of this work is really to shift the norms around tobacco product use so that young people just never initiate that. And if they do initiate tobacco use, then our goal is to support them in quitting. So this is why we continue to do this work, continue to work to denormalize these different products, which seems more challenging each day because there's constantly new products and challenges facing our campuses, which I'll talk about. But we do know that smoke and tobacco-free policies are one of the best public health strategies to prevent initiation and support quit attempts for students, faculty, and staff, which is why we focus so much of our efforts on spaces where young adults are, which is college and university campuses. So this is a timeline of the work that we have done with colleges and universities here in California. Our college work started in 1998, where we started to do some work with students who had previously been youth advocates and graduated and went away to college and recognized that their campuses were not smoke and tobacco free. 4 years later, 3 years later, we were faced with a challenge at the Cal State University system, where we had learned from the chancellor's office that individual CSU campuses could not change their outdoor smoke and tobacco free air policy. So we worked with some community partners, a lot of faculty partners, and many, many student partners to create a movement which continues today called the COUGH Coalition. COUGH stands for Campuses Organized and United for Good Health. And for a couple of years, we did some work specifically with the CSU system and really expanded that work to our other systems of higher education in California, to the UC and community college system. And over the last 22 years, we have worked on numerous system-wide policies at UC, at CSU. When Katie Moose, who I think is on the call today, who's now with the California Health Collaborative, worked with our team, Katie and our COUGH student partners really led work at the California Community College system level to get the Chancellor's Office to adopt a resolution supporting all of the community colleges go smoke and tobacco free. And so our work with public institutions is now really localized. We've done so much work at the system level, which we will talk about briefly. But we've really been focusing more on how can we support district level and community colleges in going smoke and tobacco free, and supporting the advocates who are on these campuses in doing this work. As I mentioned earlier, we do a lot of work around compliance, ensuring that all compliance strategies are equitable and not causing any kind of harm to the populations that we work with, but also supporting a shift in social norms and supporting people in quitting. And we've expanded that work now to focus on private campuses as well as trade and technical schools. And that's why we're really excited this year to have been able to do a comprehensive collection and analysis of policies at private institutions. And so today we're going to be sharing all of our findings from both of the reports this year. So just a little background, we released our first statewide report in 2016. And I want to note that our first statewide report was not our first report. We had previously received funding from the Santa Clara Department of Public Health, the County Department of Public Health, to work with their campuses in the county to adopt smoke and tobacco-free policies. And part of our strategy when we did that local work was to do a comprehensive analysis of tobacco use, tobacco treatment policies on all of the 4-year and 2-year institutions in that county. We did this, it was a very extensive review. We did campus observations, we did surveying, we did an analysis of cessation services, we did an analysis of the tobacco use policy. And then we published our findings for the county and really, again, used that to just educate campus decision makers on what was going on and how they could do better with the adoption of stronger policies and changing the tobacco treatment services that they had available. It was a really effective advocacy tool and something that we found campuses really learned a lot from, and wanted to replicate that at the statewide level, but definitely did not have the capacity to be able to do the intense level of review, because we could not go to all 148 public institutions and do observations on site. So instead, what we did was we shifted our statewide report to focus more on the tobacco use policy, the written policy that students, faculty, and staff have access to. And so on our website, you'll find a comprehensive database of right now public institutions, but we are going to be working on putting all of the private policies in the database as well. And so every year, twice a year, we go through and we collect those policies. So we have, we started this years ago. I think our first analysis was back in 2002 when we started to collect the policies. We have binders of original policies, and we do this review twice a year to see if there's been any policy changes. And then within those, we track them and we score them. We do have a scoring system, and we've modified it twice in the last, since we started the report, to really categorize and to score the different campus policies. With this, and I'll show our breakdown of scores in just a second, I do want to note, because we get asked this question every year, why do designated area policies or parking lot only policies score so low? Why aren't they scoring higher? And there's a lot of reasons for this, and we don't actually mention it in this webinar today, but it is highlighted in the report that designated areas, while the intention is good to limit where people can use tobacco on campus, they actually cause more harm than they do cause good. So one thing we know is that they create social spaces for young people to use tobacco products together. And actually social influence is one reason that a lot of young people start to initiate tobacco use and continue use. And so we really want to remove the social space on campuses from individuals to use tobacco. We also know, and there's been some early outdoor air studies from Stanford on this, that when you have larger concentrations of individuals using tobacco combustible products together in one space, that the environment is as toxic as an indoor space because there's so much secondhand smoke, and that it can travel pretty far distances. And then the other thing we know is they're just really unsightly on campuses. Unfortunately, as much as you can have signage up to remind people to put their tobacco waste into the garbage cans, it doesn't happen. So if you are on a campus that has a designated area, you probably know that that space typically has a lot more tobacco product waste than other places on campus. So we know the best way to prevent initiation and to support quitting is to have policies that completely eliminate tobacco use on campus. So this is the scoring chart. This is how we score all of the different policies within our database. We do a review both of what the policy is, so if it says smoke and tobacco free, but also the definitions that are used. We do call out and look for language on electronic smoking devices or anything related to vaping. This was a practice that started in 2016 because we started to see an increase of vaping among young adults, but also because at that time, California state law was amended to include electronic smoking devices, but a lot of people still do not conceptualize that you can't vape in spaces where you cannot smoke. And so we really wanted to ensure that all definitions were clear and understandable, and that there was no confusion along the way of where you can and cannot use any of these different products. And so this year, and with every report, we always want to acknowledge either successes or challenges that are facing colleges and universities and how this might impact the campuses and the policy work that they do. So obviously the last couple of years, we really focused on COVID. We know that a lot of campuses were closed to in-person learning because of COVID. And we also know that a lot of schools did not have the capacity to address tobacco use or even work on smoke and tobacco-free policies because of the shift of focus to online learning, as well as addressing COVID. Obviously, this is something that continues. COVID is still around. The pandemic is, while we're in the endemic, it's still here. And so we know that as campuses were transitioning back to in-person learning this year, they are still dealing with a lot of outcomes of COVID. So that's one of the things I'm going to talk about today, is how does the pandemic continue to impact young people and these policies. But I want to start with some other unique challenges that we have become aware of over the last year. So one is, there is an assortment of delivery companies out there that deliver tobacco, alcohol, other products to communities, not just to college campuses, to communities, to your home, to your business, to wherever you're at. But there are a couple of student-run delivery companies here in California. One is based out of UC Santa Barbara, and then the other was actually created, it's called Duffel, and it was created by students at UCLA to deliver food items, convenience store items to students on campus and the surrounding area. And the idea behind it is really to ensure that students can get quick access and easy access to products that they are interested in while using green energy to deliver the products. So Duffel, this company is a company that creates, it's called a dark retail spot. So it's a store that's just off campus property, and it operates as a retail space in that it's a retailer, but you can't go into the store. So they have all of their products within the store, and then student employees or contractors will get the products, and then they use a green scooter or electric scooter to then go deliver the products within a short period of time, usually like 15 to 20 minutes. And so one of the challenges that we have been having with DEFL is that we're aware right now that DEFL is at a handful of UC campuses as well as a private institution. And they are delivering tobacco products to these campuses. All of the campuses where delivery is taking place are completely smoke and tobacco free. They also have policies that prohibit the sale of tobacco on campus. But this is a little carve out. It's a little gap in the policy because delivery is permissible on campus because they're not campus stores. And so we've been kind of looking at what are some policy options for our partners to be able to adopt to try to prevent the delivery of tobacco products onto campuses. Since again, we know that student access to tobacco makes it more likely for them to use these products. And the challenge with these products is that many of them are also really easy to hide when using. So this is something that we are exploring with some of our legal partners. No answer yet, but we hope to learn more about what's happening and how to address it in the near future. Something else we know is that students are using marijuana on campus. So some of the challenge around this is that we do have legalized marijuana here in California. We do know through many of our focus groups that young people associate the legalization of marijuana with making it feel like it's safer and it's okay to use. And so we have seen and continue to see an increase in college student marijuana use over the last 5 years, a steady increase each year. I want to note that this is not just in California, this is a national thing that is happening. So some of the challenges specifically for colleges and universities is that policies that are already smoke and tobacco free are inclusive of these products. The definitions are written really well to be inclusive of any combustible or vaporized product. Also, with many colleges and universities, they have substance use policies that address marijuana because at the federal level, marijuana is still considered to be a class 1 drug, and so it's not legal on campus. So technically, these products should not be on a college or university campus. With that said, again, it's really difficult to know if somebody's vaping on campus. Are they vaping marijuana? Are they vaping a nicotine solution? So the idea is that, again, with our smoke and tobacco-free policies, if we denormalize use across the board, then we can prevent initiation of these devices. The trick, though, is I want to recognize that the burden of the use of these products often falls on our student health centers, who may not have the capacity or the staffing or the funding to be able to address all of the different things that students may be vaping or smoking or using. And so they are dealing with a dual epidemic of student vaping, both nicotine and marijuana products, and then the treatment of those looks different. And how as a state we are responding to nicotine and marijuana or cannabis looks different. So again, this is something that we're exploring of how we can help our students and our college campuses with. And then I'd be remiss to not highlight that we know that COVID had a significant impact on mental health among youth and young adults. This is reality. If you work with college students, you know that a lot of students are dealing with post-traumatic stress or depression or anxiety that comes from what happened over the last 2 years. I also want to note that while COVID was one thing that happened over the last 2 years, there's been many more things that have been happening and have really been accentuated over the last couple of years. We've dealt with a lot of racial justice issues, racism. We are dealing and still dealing with school shootings and trauma that are associated with school shootings, K-12, college and universities. We're also dealing with a lot of issues around enforcement and trying to change what enforcement looks like, which is why we've done more work around compliance and talking about equitable enforcement. But really recognizing the young people that we work with on colleges right now have a lot of burden on them and have a lot of things that they are dealing with, in addition to an economy where students have increased tuition and increased expenses and maybe working more. So we need to be aware of and supportive of the mental health of the students who are on the campuses that we work with. We know that substance use changed during COVID. So this is something that we've been exploring and wanting to pay a lot of attention to, because what's interesting is when these researchers looked at the virtual space of, this is high school age young people, but when students were learning at home, they had significantly lower rates of tobacco use and marijuana use than when students were learning on campus. And again, that's not surprising, because in our own survey that we did last year, as well as any published research we have on youth and young adult substance use during the pandemic, we know that when young people were at home, if they were experimenting with products, they had less access to products because they weren't sharing them, they weren't able to get them, and they had they didn't have social spaces to use them. And so in schools where young people have social space to use, to borrow, to take a hit off of somebody else's vaping device, it makes sense that the use is higher. And so what we're all now looking for and kind of waiting to see is that as students went back to school in the fall, and in some cases colleges reopened in January, are we going to start to see another increase in youth and young adult tobacco and marijuana use as a result of coming back together? Pair that with mental health. And then we know, of course, that there are specific factors that are associated with student tobacco use. One of them, rating high, is mental health, which we've already talked about, the impact of youth and young adult mental health. And then we also know some other things. I talked about accessibility and availability, having just challenges within school, challenges outside of school. And then we know low self-esteem, low self-image, and again, connection to mental health. I also want to note that there are a lot of evolving products that are out there. So we have, this is kind of just a sampling of some of the products that we've heard from schools that they are seeing and confiscating this year. And these are from K-12 schools. But we're really looking at what are these devices, and the challenge with many of these devices is that they're bigger than what we saw 2 years ago. So these are all disposable. They're all designed to be used and get through the puffs. The original pod-based devices were anywhere from 200 to 400 puffs. Some of these newer devices have 3,000 puffs. So they last longer, they have much more nicotine, and they can be shared more. And they're harder to find because, again, if you look at them, they're constantly changing and looking different, and sizes are all different. So things that we are all really paying attention to. So with that, I want to get into the findings of our report, and Crandallin and I are going to be going back and forth on some of these different findings. So I will turn it over to Crandallin to talk about the public report card.
Perfect. Thanks, Kim, and thank you everyone for joining us. So when looking in our public institutions for 2022, we did go up in trajectory. So despite all of the different factors that are going on with COVID and a lot of stuff that's going on in the world, our universities, our public ones, are still working on adopting comprehensive smoke policies. So there, if you can notice in the chart, between 2012 and 2013, as well as 2016 and 2017, you can see there was a huge increase in percentages. This is around the time in 2012 where the UC as a system adopted 100% smoke and tobacco-free policy. And this includes their 10 campuses as well as their hospitals. And then in 2017, like we mentioned before, the CSU adopted their policy. So a little bit slower progression, but it's still in a higher trajectory. When it comes to new adopted policies this year, we are excited to share that 3 of our community colleges, all within the San Mateo Community College, have adopted 100% smoke and tobacco comprehensive policies. So you have Kenyatta College, you have College of San Mateo, and Skyline College. And we wanted to do a huge, significant call out to the San Francisco Community Health Center for their due diligence in working with each of these colleges, primarily Skyline College, faculty, staff, as well as students, to really help get the policy off the ground and adopt it. So we wanted to just kind of recognize the San Francisco Community Health Center for the work that they have done. Some other policy changes that we wanted to kind of talk about, both positive and in a little slide ways going down, but we'll talk about that in detail, is Sarasota Community College has now went from without having a rental policy to now designated areas. Our Los Angeles City College went from 100% smoke-free to now designated areas. And then Mendocino colleges amended their designated area to really include electronic smoking devices, which is also pretty huge. So even though they're not 100%, these changes do affect their scoring that you'll see in the report. So we just wanted to recognize that. And so in totality, when it comes to our three different public systems, we know the UC and the CSU systems are still 100% smoke and tobacco free. And then out of our 115 California community colleges, 62 of those do have smoke or tobacco free policies. And so I mentioned it a little bit, but just to kind of highlight again, in 2012, our UC system together adopted a system-wide policy that includes all 10 of their campuses, including UCSF or UC San Francisco, that is their graduate college, as well as their hospitals that are associated. I believe there's about 5 of them. They all have policies. And then in 2017, our CSU also adopted a policy as well. When it comes to our California community colleges, we have several different resolutions that were passed. The first one being in 2018, where our board of directors for the community colleges came together and adopted a resolution to help support and provide guidance on making the California community college system 100% smoke and tobacco free. And then a couple other resolutions came out from that. The resolution first in 2017, which our Student Senate of California Community Colleges, also known as SSCCC, came together and passed 2017, which is to really support access to tobacco treatment, because again, using tobacco products is an addiction. And so we really want to help students quit. And with that, we need those tobacco treatment services. And so also the promotion of designated area policies. However, about a couple years ago in 2020, our SSCCC, as well as our Black Student Caucus, came together and passed a resolution to really recognize smoke and tobacco-free policies as a really priority for all of our 115 California community colleges. And so there you can see in that bar graph that we showed that trajectory as well, and that positive result of these resolutions. And so when it comes to comprehensively, as of last month, we have so far, none of our public public colleges and universities are not within compliance with the state. So as you can see, we have 0 of them to have no written policy. All of these universities and campuses have policy. And then we wanted to also note that if a campus has had a policy other than an entryway, then that means that college has adopted a tobacco-free policy since 2004, which is also something to celebrate as well, because if you can see in the graph, a small fraction of our colleges and universities have still entryway policy. So a lot of good work. We're super excited and proud of all the work that's being done within our college and universities, as well as our partners and our COP students. So with that, one last slide before I pass over to Kim. It's just if you're looking at the report card, how our community colleges are structured. So they're they are categorized by 10 different regions, and these regions are defined by the Chancellor's Office of Community Colleges. So in case you're wondering how that is categorized on our public university report card, it's going to be based off of this structure that you see here. So with that, oh my gosh, so sorry, y'all. So the last thing that I swear this is the last one is some standout regions that we wanted to highlight. So again, out of the 10 regions, there are 3 that have A minus, and A plus region. So we wanted to also kind of call those out too. So we have region 2 that has an A minus average. We have region 3, which again, we wanted to highlight those 3 community colleges, and they're all part of region 3. And so we're super excited to have that average now be an A, as they are closely aligning with region 10, who has been an A plus for several years now. And so again, we want to celebrate and thank you all for the work that you have done in all 10 of these regions. And we're excited to keep working as there's more work to be done when it comes to really making sure that all of our community colleges are going to be aligned to that 100% smoke and tobacco free policy.
Great, thank you so much, Crandall.
You're welcome. So sorry for all that.
Yeah, there's a lot of data, and I'm sure we could have probably found more to share with you all today, especially our thoughts on kind of where to go next. But it's all in the reports if you have the time and energy to read all of these things. But now I'm excited to share with you all our findings from our private report. So again, just to note, this is the first year that we have released a report on findings on private institutions. There's many reasons behind that. So you heard me talk earlier about how we have really focused a lot of our work on public colleges and universities. Some of that is due just to the governance of public schools. They all exist within 3 different systems. And so learning the governance of 3 systems is different than learning the governance of 110 private and individual schools. Actually up to 1,000 when we bring in all of the trade and technical and vocational schools across the state. We also have done extensive work with all 3 systems. And prior to even when the UC system adopted their smoke and tobacco free policy, we were doing localized work with UC, we were doing localized work with the CSUs. We've always done that local work, but then when there were opportunities to do the system-wide work, we really jumped on that as well. And so being able to work towards a system-wide policy that impacts all of the campuses within the system, or even guidance from one system, really allows and kind of provides direction for those individualized campuses. All of the public schools also practice shared governance and have similar governance, even if slightly different. Say, I would say probably the most different is the community college system, and especially with their district leadership, but still pretty consistent. So we have yet to spend a lot of time focusing on private institutions. We have been very fortunate to partner with and support work that has occurred at private institutions. But every time we work with a private college or university, that work, those lessons learned, all of those things are very individualized. We've worked with private institutions who are non-religious, and they have a way of governance that includes different layers that might not exist at public institutions. We've worked with religious organizations or colleges and universities that have a very specific way of bringing in, for example, their brothers and the different colleges of brothers that they have that they are working with and the influences there. So it's a whole different experience to work with these schools. The other thing, and I would say this is probably the biggest barrier to why we have yet to do an analysis until this year, is that it's very tricky who the private schools are and which schools are we reviewing, which schools are we cataloging and tracking. And so after years of exploring private institutions in California, this year we decided that we would start our collection and analysis with colleges and universities who are part of the Association of Independent California College and University. So the association is a collective of 110 member campuses. Most of these campuses offer at least a 4-year degree, but many of them may also just have a graduate program. So these tend to have longer programs in, say, a vocational school or trade or tech school. We only reviewed active members of the AICCU. So there are some that might be kind of dissolving. And then the other challenge that we have is that in California, there is no one body that oversees all institutions of higher education. So it's really difficult to track down which ones exist. It is not uncommon, especially after COVID, for there to be an institution that offers some sort of higher education, whether it be a certificate program or a degree, and they closed down because they were private businesses offering higher education and had financial challenges due to the pandemic. So it's really tricky to monitor and to document all of that. With that said, for this year's report, we decided to go with the association list. So Crandallin and Jocelyn took that list, pulled all of those policies, did extensive review of all of the policies. And as I mentioned earlier, Jocelyn had to call a number of policies or a number of campuses to find their policies for the analysis. One thing I didn't know at the beginning, but I really want to emphasize this here because we are releasing these data to you all. We base everything off of the written policy that we have from a college and university. And so if a campus cannot find a written policy for us and they just verbalize, we do not classify that as a policy, because part of having a strong smoke and tobacco-free policy is it's accessible to students, faculty, and staff so that people can comply with the policy. So if people are not aware of the policy and they can't access the policy, they will not follow the policy. And so that is something that we are pretty strict with doing an analysis on. So with that, I'm going to jump into our findings from this year. So again, I mentioned our sample size was 110 schools. These are active members of the association. And we found that 47 of those schools are 100% smoke or tobacco free. So of those, if we look at it collectively, it's about 43% of private colleges and universities in California are smoke and tobacco free. We did a lot of work to look to see how can we do an analysis of these data. So for the public report, we look by system, and then for community colleges, we look by region. So for our private schools, what we wanted to do is we wanted to look at religious affiliation, because there's a pretty decent number of religious campuses within the association. And then we also wanted to look at region, which I'm going to talk about in a second, why we decided to look regionally. But so interestingly, not surprising though, after reading these policies, we did find that 68% of religious affiliated colleges and universities are smoke and tobacco free, compared to 26% of schools that do not have a religious affiliation. So after reviewing the policies, this was not surprising, because what we found is that many of the religious institutions actually have substance use policies that prohibit the use and possession of all substances. So it was not just unique to tobacco use on campus. Many of these schools have policies that tell their students, it's part of the student code of conduct, that they cannot use or possess any substance while students at the institution. So it's not even using tobacco on campus, it's using tobacco overall. So in all honesty, while it's great that these policies are inclusive and prohibit the use of tobacco on campus and the combustion and vaping of marijuana, Jocelyn did call them, if it was not explicit, that the policy covered the entire campus, which the ones included in our report do include faculty, staff, visitors, contractors, everybody. We want to note that we believe very strongly that no one should be penalized for their use of tobacco. This is an addiction. This is a public health issue that we do our work to try to prevent and try to support people in quitting. And so we hope to have the opportunity to just get clarification from our partners at private institutions to ensure that if students are using, are addicted to these different products or are in possession, that they're getting support in quitting and that they're not getting criminalized or have punitive enforcement because of their use. So that's definitely something that we will be, as expanding our work with private institutions, supporting those campuses and doing and ensuring that students, regardless of their campus, have free access to tobacco treatment services to support them in quitting. So now looking at the breakdown by policy type, I had mentioned to our team at CYN that this reminds me of some of the first analysis we did on public colleges, where we saw more schools without written policies and then some of these other entryway and designated areas. And a lot of that was because campuses were just not working on smoke and tobacco-free policies. This really is not a priority issue for schools unless they have local partners who are working with them to address tobacco use. And so this is where I know if you are an advocate from a school or if you are a local public health partner that's working with schools, I think this is important to show the gap that we have a lot of support left to provide to private institutions in California. And again, just to note, we did an analysis of 110 schools. We did not look at all of the trade and technical schools that are out there. So there is plenty of work left to be done as we've been so successful with work in the public sphere. The other thing to note is that state law in California, outdoor air law, does not apply to these institutions. So we have a law, it's called AB 846. And AB 846 passed in 2002, and it prohibits smoking within 20 feet of all public buildings, so all state-owned buildings, including colleges and universities. And in 2002, that language on colleges and universities was actually intentionally added into that law. And so because of that law, many of the schools simply updated their policies to entryway policies already to be in compliance with state law. But that law does not apply to any of these schools because they're privately owned spaces. However, if there is a local city ordinance that has an outdoor air law that prohibits smoking within 20 feet or 30 feet or whatever it may be, the private institution, in theory, should be compliant with that city ordinance. That was something that we did look at, and there were a number of campuses that did note their city ordinance and that they were in compliance with it. But again, this is really up to whether or not there is a city ordinance. So with this report, we decided instead of just putting all 110 campuses out there in alphabetical order, we did want to organize by region. And the reason for that is because we wanted our public health partners at the local level to see where there's work left to be done. We know that a number of you who might be on this call today may have funding to support campuses in adopting and implementing smoke and tobacco-free policies. And so it's really important to define, where can we do this work? What does this look like? So the regions that we used are the regions that are defined by the California Tobacco Control Program. These are the regions that currently have funding for priority population grantees. And we really wanted to explore within the different regions, where's the work? What left do we have to do? So what's interesting about this, though, is that you'll notice in the report, not every region is listed out, because not every region in California actually has a private college or university. And so there was nothing to review. And in some cases, there might only be a couple of schools. Again, these are only private schools who are part of the association. So for example, I know that in the Central Valley region, that blue area in there, there's only 2 campuses that are included in that region because there's only 2 campuses that are part of the association. However, I also know that Tulare County is doing some really great work with trade and technical schools. So those schools aren't included in here. There's great work to be done, but this report does not include those. So as you're going through the region, definitely take a look at those and recognize that some regions might have 3 schools. And then in the case of Los Angeles County, there's 2 pages worth of data because there's a lot of private schools within that county. So go into the report, look by region, and then by county, everything is listed by county and then alphabetical from there. And so from there, I'm just going to turn it over to Crandlin to share the findings when we compare the systems of higher education with the private institutions.
Yeah, so when we took and analyzed both public and private, what we found is that when you put in all those colleges, about 59% of our colleges are either 100% smoke or tobacco free, which is actually really exciting that over 50% of our California colleges have some type of smoke or tobacco free policy. So in addition to that, in the purple, you're going to see the private, and then in the gold is our public colleges and universities. And then as you're probably navigating the report card, that purple is going to be also affiliated with the private robust report card. And then you have that tan teal color for our public ones. But for our private and public colleges, when it comes to including the e-cigarettes in those policies, in comparison to 97% of our public colleges and universities, 65% of our private colleges and universities also have included e-cigarettes in their policies, which again is really exciting to know that as we are progressing into these different types of tobacco products, that our private colleges are actually utilizing and kind of adding that into their policy as well. And then when you look at the tobacco free, in comparison to 70%, 43% again are 100% smoke and tobacco free. And then breaking it down by the different years of our public universities. So our 4-year, our 2-year, which is typically our California community colleges, and then our private universities and colleges. These are the campuses that are going to be 100% smoke or tobacco free. So as we know with our UCs and CSUs, they're 100% smoke tobacco free. When it comes to our public universities or our California community colleges, they're about 62%. And so with it comes with our private universities, they're a little bit under 50%. So 43% are going to be smoke or tobacco free. So lots of work that needs to be done with our private colleges and universities. But again, we're really hopeful and excited to actually start working with them, knowing that we went through what we did with our public ones and the different governances. We are excited to kind of get in deep dive into our private colleges and universities. And then when you break it down by kind of similar to what you kind of saw previously, when you do a comparison analysis between the public universities and the private, you can see when it comes to kind of looking down from no written policy, again, like Kim mentioned about the different ordinances when it comes to the city and the fact that private universities don't necessarily have any like indoor outdoor ordinances. About 8% of our private universities have no written policy. And then as you kind of matriculate into those that are 100% smoke and tobacco free, you have about 30% of our private universities and colleges that are going to be in that realm. And so you can actually on your phone take this QR code to actually figure out where your school and or community is scored. And so you can do this QR code, or the link right there also will take you to our webpage with our California Tobacco Free Colleges that has a robust report for both public, private, and then we also have some summary sheets that you can also download that does a comparison analysis of those two public and private universities as well.
Thank you, Crandallin. And with that, that's the data this year. Again, all of these reports, a lot of what we had shared within today's webinar, some of the challenges ahead of us, some of the unique findings, all of those things can be found in both of these reports, which are on all of our websites, our CYN website, but also housed here on a report card page. We also have summary reports of public, private, and then all of the findings from the two combined data on the site. So we hope you have an opportunity to review it. And then we did want to spend about 10 minutes just kind of opening it up to all of you to share any questions, any thoughts. Again, we are imagining that there might be a lot of questions on some of the private policies that are out there and kind of what we found. We're also happy to talk offline if you have any questions. But again, the intention of our findings and the work that we do is to just help open up to see where there's work left to be done and how we can support the work with the schools. I think that it's just important, and I love that Mark is on the call and shared the work that they did in San Mateo County. Our partnerships as public health advocates are really important to support colleges and universities in this work, and to support them not only in the adoption of policies, but ensuring the policies are effective, and ensuring that health centers have the ability to provide tobacco treatment, or at least resources. And if schools don't have health centers, that we can at least link administrative into all of the free resources that exist in our state and at the national level to support students and faculty and staff in quitting. So with that, I have my chat box open and Q&A. If there's any questions that anybody wants to share, go ahead and put that in. Otherwise, thank you so much for being here. And I do see that Teresa is on and raised your hand. Let me see if I can unmute you, Teresa.
I wanted to know, because I'm working on the policy at Chico College. I want to know if there a grant or something that could help me put the program to use.
Yeah, that's a great question, Teresa. So in the past, the Truth Initiative has funded work at a variety of schools, including community colleges here in California. They've funded a lot. I am not aware of any open grant funding that they have. They recently did a round of funding at the national level, but I would definitely, I'm happy to check in with our partners at the Truth Initiative to see if they have any new funding opportunities come up.
Yeah, because I missed the last one. So yeah.
Yeah, we will, I'll look into that, Teresa, and either myself or Crandlin will reach out to you with that answer.
Okay, I appreciate it. Thank you.
Yeah, of course. Are there any other questions or thoughts on anything? You can raise your hand so we can unmute you, or again, you can put it in the chat box. Okay, well, I don't see anyone. Our team will stick around just in case you want to stay on and share anything. But if not, just thank you all for being here today. Thank you for your work at the local level, at the regional level, at the system-wide level. Some of you are doing it all. And as we mentioned, there's still more to be done. We are excited to support that work. And one of the things that we have been kind of toying with, we couldn't do this before we presented today, but we're also happy to pull any of these data for your county. So if you work within a specific county and you want to know what are the averages for your county, what are the policies in your county, go ahead and just reach out to us and we can share all of that information. And actually, I think I stopped sharing my screen too soon because on the back end of our presentation is actually all of our contact information. So I'm going to leave this here for you all to see. Is it up? Kind of, sort of. Okay. So here's our information. So if you did want to see something by county, if you were interested in knowing, if you are interested in talking through a policy and why did we score it the way that we scored it, what do we think about something, how do you create partnerships with schools, whatever the case might be, please just reach out and we are here to support all of the work that you do with campuses in California. Thanks so much, everybody. Have a great afternoon.